This is the second day of treatment, and my client is a collegiate runner on scholarship, a national title holder. Am I wording that wrong? Not a record holder.
Fastest time in the country 1 year.
Yes, yeah.
Yes.
And we're not going to say which event.
Yes.
And we're not going to say your name. And we're not going to put your face on the picture. So we're just respecting privacy and requirements of your sponsoring body. All right. So we treated you twice. And you had this problem for more than 2 years, correct?
Yeah, it was probably about 2 years.
And you had a lot of treatment, x-rays, MRIs.
X-ray, MRIs, chiropractic treatment, physical therapy. Yeah.
Probably also saw athletic trainers.
Yep.
Okay. And how does the work differ? So you came here and we spent 2 hours with you yesterday. And how is that different than the care you've received?
I think it's more open-minded. It's not necessarily going into things looking for a specific issue. It's knowing how things should be working and then recognizing how they are working and then trying to restore that normalcy.
So one of the things that we evaluated and treated was micromotions, lots of little small movements in the small joints in the foot. Comment on that.
Well, I think especially as a runner, if something so small if something small is going wrong, especially in the foot, if you're taking, you're running 80 miles a week, then every small little issue is going to be compounded hundreds of thousands of times over time, and any little issue that can be resolved is going to be a big help in the long run.
It's a complex structure. It's 26 bones, 26 joints. And they are different. I mean, each of your toes functions rather similarly, but if you compare the toe joint where it joins the metatarsal, and you compare that to the cuboid or to the talus, completely different joints with completely different movement patterns in the 3 planes of the body. And so it's an intersection of lots of different types of motion. I'm not sure where I'm going with my thoughts, so I'm going to look at my next question. Do you feel like you now have an understanding of what was going on with the left foot and ankle?
Yeah, it was more of, I already had felt like what was happening was what was happening.
Yes.
You were able to just articulate it and make it much more clear. I had a pretty good sense that pronation wasn't happening in the left foot, and wasn't totally sure why, but now I have a good sense for that.
And how's it behaving now?
It seems definitely improved just from the first day. After the second day of treatment, if I were to run now, I'm sure it would feel better than it did this morning and yesterday even.
And so after treatment yesterday, you ran, and how was that?
It was good. What we adjusted in the hip felt totally different. And I didn't even recognize that was an issue totally.
That's an interesting point. Probably no one had looked at the lower part of your pelvis.
No, I had known that there's probably something going on, and I figured it was due to the ankle or foot not moving correctly. But it seems like it was more potentially its own thing maybe. And after that was treated, it definitely felt different, which was good relief too.
I'm optimistic. This work tends to be long lasting, and once you restore the normal movements, then when you're running, your body seeks those movements. It finds them naturally. Now you naturally go into normative amount of pronation. So once you restore all of those micro motions and connect the dots, connect pelvis
Yeah.
to foot and ankle, then it tends to stay. Do you feel like you know enough to self-manage this?
Yeah, I do. I think when, especially paired with the videos, I feel confident I'll be able to manage this on my own now.
Very good. Well, it was an interesting case, and I'm so glad you made it.
Yeah, I
And
was very thankful glad I was able to drive out from Maine.
yep.
Yeah, definitely a positive experience.
And stay in touch and let us know how you're doing.
Yeah,
and
I
we'll
will.
follow your
Yeah,
schooling and your running.
awesome. Thank you very much.
Yeah, thank you.
Yeah, I'll
Appreciate it.
definitely keep you updated.
Cool.